Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.
Hello, everyone. I'm Barbara Hamley. Most of us know where our next meal is coming from. In fact, you may be eating lunch while listening to our show. But have you ever really thought about what it means to be truly hungry? To have no idea when will be the next time you'll get something to eat? Someone listening or someone you know may be food insecure right now. Up next on Another View on Health, food insecurity and its impact on your health, especially if you have a chronic disease. Stay tuned. Another View on Health with cardiologist Dr. Keith Newby. We'll be right back after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamley. Before we get started with our favorite cardiologist, Dr. Keith Newby, let me tell you about an event that is going on. You know, this is the last weekend in October, which means that the kiddies are all gearing up, and grown folk too, to put on their costumes and celebrate Halloween. So if you're looking for a safe space for your children to enjoy the holiday, the Hearts of Joy Home Care, Creative Customs, and My 2K Foundation are providing Trunk or Treat on Saturday, October the 28th, from 4 until 7 p.m. at 801 East 26th Street. So that's at the corner of Lindenwood and 26th Street in Norfolk. There's going to be candy, face painting, games, a bouncy house. Come on out, let your kids have a good time in a safe space. And we thank these organizations for pulling together and taking care of our youth. So according to Feeding America, in 2021, 20% of African Americans were food insecure, 3 times the rate of white Americans. Single mother households and those living under the poverty rate experienced hunger the most. So what happens to your body when you are hungry? And how does it impact you if you also have a chronic disease? Joining us to talk about hunger, food insecurity, and your health is our favorite cardiologist and Centera's medical director for health equity, Dr. Keith Newby. Hello, my friend.
How are you doing?
I'm good. How are you? I understand you were taking a walk before the show.
Yeah, actually, I try to do that every day anyway, but I had to do a clinic for the hospital that is for people without insurance. I have to do every so often, and I was there to that, so I just walk over there and I walk back. That gives me at least part of my walking in for the day. But I like to walk the parking deck in the Fort Norfolk building because it's 9 stories, so I just start at the bottom and go up each flight and, just walk around the deck. I got to do it at night because I'm going to tell you, them people come flying around that corner. I'm not trying to be a casualty.
Yeah, well, having parked at that deck, I agree with you. You do have to be very, very careful.
Yeah,
that's
so I
for
usually
sure.
wait till the evening time when everybody's gone. I know I won't be a casualty. I'm not trying to be an active participant in the trauma unit across the street.
Thank you very, very much. We don't want you there either. So do you have a goal? Do you have a number of steps that you do every day? Or you just get to walk in?
Well, I'm always 15,000 or more a day. It's just part of the. I mean, you remember what I do for a living.
Yes. Yes.
I don't. When I come in the morning, I park here at Fort Norfolk. I always walk across the street. So I don't even know if my parking pass works at Norfolk General. I haven't used it in 15 years.
Wow.
I just walk across the street and I walk through the hospital. I try my best not to take the elevator much. Just better to get the physical activity in. I'm on a diet anyway, so I'm in my reduction mode now.
Keith, you know what? You are always on a diet.
I know. Well, you know something though, but I'll tell you though, I ain't gonna make this a loud story, but I took my wife to D.C. about a month ago, for her birthday, and we were at the FDR monument while we were there, and somebody took our picture. I looked at that picture of myself. I was like, oh no. I said, oh no. I said, starting that Monday, I was on. Unless I'm gonna tell you, I dropped 12 so far.
Wow.
October 29th. Because September 29th. When I get on a mission, and that was all I needed to see.
Yes.
And every time I want to eat something wrong, I just pull that picture out, and it takes my appetite right away.
Well, see, now we can sit here and joke and talk about eating because, blessings. Neither one of us happen to be food insecure, but we do know that there are tons of people in our community, and particularly African Americans, who are for a variety of reasons. So let me start by asking you, what is food insecurity? Because we hear the term, but what does it mean?
Well, essentially, it's just not having enough food for your needs. Now, this is the issue where it becomes difficult. That is very much a subjective definition. If you really look at it in terms of how they define it. But what the USDA has since come out with a slightly more defined example. Like if you look at it, because they categorize people as low food insecurity or very low food insecurity. So when you talk about low food insecurity, and this again is from the FDA, so they say reports of reduced quality, variety, or desirability of diet, little or no indication of reduced food intake. So you're talking where you don't have exactly what you need. You're getting by. But when you talk about very low, you mean reports of multiple indications of disruptive eating patterns and reduced food intake. So, at least with low food insecurity, you have food that just maybe not the best in your best interest to eat that type of food because it may be high in calorie and high in fat and low in nutritional value. But when you're very low, you don't have food, period. So that's kind of, as they're looking at it, they try to define it better. But some of that's subjective because if you say somebody says, okay, they talk about if you go to bed hungry. Well, a lot of people that are 400 pounds go to bed hungry.
Well, I was going to say, because it seems like there's a disconnect because when you also look at the numbers, there was an article that just came out this week that said that the majority of Virginians are obese. So how does obesity and food insecurity, how do they correlate?
Yes, well, it's about what you choose to eat based on your dollars that you have. So in other words, I can go to McDonald's and get a dollar value meal, which is I'm only spending $1 plus on the food, but the problem is it has little to no nutritional value. And I'm not knocking McDonald's. I mean, I ain't trying to.
It could be any. It's all. Yeah, exactly. It's all any fast food
place. Any fast food place out here where the intake is, it may be high enough to cause weight gain, but not high enough to improve your nutritional health, and that's the part that leads to the things we'll be talking about today, which is those chronic conditions and how you can make them worse. And unfortunately, and the biggest problem I have is as it relates to who a lot of these commercials and the advertisements, who do they target? That's where you run into our problem. Just like cigarettes, all the menthol cigarettes get targeted to African Americans.
Right.
And same thing with certain. You turn on any of these fast food commercials, and who do you see generally speaking up there? Who they're targeting in terms of the advertisements. That's the problem. I mean, listen, some of that stuff does taste good for some, but the problem is what it's doing to you, and at least that obesity, that all the medical problems come from that. Come from that.
And the impact on children is what in terms of food insecurity?
I mean, it's this could be substantial. I mean, you talk about they say 1 in 8 Americans are food insecure. So you talk about 22. At least nationwide, it's 22 million low-income children qualify for free or reduced, school lunches. So you talk about a pretty substantial number of individuals. So, and even in Virginia, and this is all that we know. See, the thing is, caution everybody on stats. Stats are based on the interviews they make, who participates in the stats. So if you have, like, say, 1 million people, but only a percentage, like, say, 40% actually participate in any surveys, you may be missing a bunch of people, that may have this problem. But I know they say in Virginia you have 800,000 people deemed food insecure, in Virginia. Now, that's all we know about. I guarantee you there's more than what we know about.
Yeah. And I was looking up some information. So there's tons of information out there about how the Black community consistently faces hunger at higher rates than whites due to social, economic, and environmental challenges. So they're saying 20% of Black individuals experience food insecurity, which is almost 3 times the rate of white households. And a lot of it has to do with making the difference or making the choice between buying food and paying rent, or your car breaks down, or there's some other, or medication you may need, as opposed to food.
Yeah, when you look at if you look at the 2 main issues that lead to food insecurity, and you touched on one, is poverty. Your income that you make and how that impacts on your choices. The second thing is your built environment. So look at neighborhoods that you go into that are predominantly African American. What access to food do they have there? Typically, it's going to be these convenience stores. It's going to be fast food joints. Typically you go to a Black neighborhood, you're going to find a Chinese joint in there. Like food place, and then you look at the types, the soy sauce, the fried, rice,
right,
and the way they cook the food is typically going to be super high in sodium and super high in fat. So that tends to, and again, I mean, hey, it tastes good. I'm not going to lie on that one. It's just, but what it's doing is it just seems to be, and I understand for some. A lot of businesses say, well, listen, crime rates may be higher in certain neighborhoods. We don't want to put our stores there. Then we have to worry about safety of people, all this stuff they come up with. And I hear them, but the bottom line is we could do better as a community by still allowing, the proper, places and stores and restaurants and things that could be in those neighborhoods, to be in those neighborhoods. And then we just have to say we may have to, do other mechanisms to ensure safety if that's the concern of the businesses. I just want to make sure our people are cared for.
Absolutely. 757-440-2665 or 1-800-940-2240 are the numbers to call. Have you ever been food insecure? What were the coping mechanisms? What did you do in order to work your way through a situation? They talk a lot about how for some people it's temporary, for others it's long lasting. We'd love to hear your story. 757-440-2665 or 1-800-940-2240. So, Keith, we know, you learned from biology in school that you got to eat in order to have the energy for your body to work. But what happens when you don't get good nutrition? What happens to your body?
Well, essentially, it's a couple of things. One is your brain power is reduced. Which is why they push so hard for children, to have a good breakfast, a decent lunch, because, that's that food that you need for brain power. So if you're lacking in that, you're hungry, so you're not concentrating on your schoolwork. You're concentrating on the fact that you're hungry. And secondly, if that which you do eat, think about times that you have taken an initiative to I'm gonna eat properly. You cut out all the stuff that you typically eat that you're not supposed to eat, but you typically do anyway. But you cut all that out and think about how you feel over time. The first thing, anytime you change your diet around, you got to go through that withdrawal phase because you're used to sugar or whatever else you're eating. But after you get to a point, like right now, the one thing for me, after I saw my little interesting picture, and I decided to, kind of say, let me.
Did you post a picture on Facebook?
Oh, heck no. Absolutely not. But the thing is, the bottom line is I knew I was, with COVID hit, a lot of us kind of got a little bit on the trifling side. Some of us didn't, but some of us did. I was the one that did, and I have now gotten I mean, that's all I need to see. But,
Yeah.
I say all that to say that when the first, I think, week and a half, because I really started cutting out all the sugars. I cut out a lot of the extra bread, the rice, pasta, all that stuff. I mean, is that to say this stuff, you could get complex carbs that are healthy for you. I just took, my initiative was to trim all that back. I just do a lean meat if I do any meat at all, and vegetables. That's all I've been eating over the last month. And I'm going to tell you, the first week and a half was tough. But again, I just pulled out that picture, and that took my appetite right away. But I say all this to say, now, I feel like so much better with what I have done and the changes I have made. I'm dropping 50. I'm going for 50. I already dropped 12, going for 50. And I'm saying all that to say that what that does for me and what it's done for me is I feel like I'm thinking more clearly. I wasn't ever bad, but I could see the improvement and just and how I feel. And a lot of people don't really realize that, but I have different advantages. I'm not a poor person. I do have money to be able to eat and do the things I want to do. Other people don't have those advantages to try to eat in a healthier way. Right. And what happens is because they don't have those choices, it's going to be more difficult for them to do that. But I feel so much better eating properly. And that's the thing that I want to reemphasize. And for kids, they're in a development stage. Their bodies have not matured. So
they need those nutrients more than ever.
More so than anybody. But you look at performance in schools with kids that are food insecure versus not. There's a clear difference. And that's the thing. We want to give our kids a fighting chance, and that's part of it. And you'll find. Because my grad school work I do, I'm doing a project on food insecurity in North Carolina, just because Chapel Hill is where the school is. But it's kind of interesting. The same problems in North Carolina are the exact same problems here. There's always the issue of when you talk about the federal programs like SNAP, and WIC. I know everybody knows those things, but of course WIC is the special
women, infants, and children.
And then the SNAP is what is it? I forget the name. It's a supplemental program that I remember reading about. But anyway, that's kind of like what food stamps used to be called. And I think it's supplemental nutrition assistance program. Right. So there's going to be a lag in terms of people who can participate and who actually do. And a lot of it is governmental red tape. They have difficulty filling out the forms because they're complex and tedious. So you have a certain percentage of people who have the ability to participate, but they don't because they either couldn't understand how to fill out the forms or some other thing. Some people, it's a stigma for some. They don't want to appear like they're, poor. And so they don't want to participate, but then they suffer as a result. But I say all this to say, even with school breakfast, it's kind of an interesting dynamic. So a lot of schools, they just offer free breakfast to every kid. Norfolk Public Schools does it.
Yeah, in order to take away the stigma.
Exactly.
For those that might not be able to afford food. Right.
Exactly. But this is the crazy part, though. So when you look at the actual percentage participation, and this is typically the same in North Carolina and Virginia, the school lunches typically is 85 to 90% participation. In breakfast, it's 45%. So you may ask, well, what's the difference? Well, it's interesting. Of course, you ride the bus. If the bus don't get to the school on time, you can't have the breakfast. Or it's crazy. It's the same problem in both places. So instead of them saying, okay, let's figure out, so we got this problem of poor participation because of dynamics of
how we get the kids to school.
But instead of trying to come up with the workaround, they just leave it like it is.
Yeah. And it always comes back to systems and the systemic issues that keep people from being able to succeed and move forward.
Exactly.
Yeah. That's tough. And there are people who may be food insecure who may not even qualify for SNAP or some of these other benefits, but for whatever reasons, their income or they're not spending the money in the same way. So when you said you were talking about eating lean meat and vegetables, but that doesn't mean with fat back in the in the greens,
Exactly.
right?
Yeah. Because I can take, as like I mentioned before, I think you and I've had this conversation before. I could take something good and make it really bad really quick.
Right.
By altering that nutritional value part. And if I'm going to put all that in there, and again, I don't dismiss. It's a lot of it's just cultural, how we were raised, how we were taught, and to think, and what we deem as what tastes good and what doesn't. There's a lot of ways you can make things taste very good without the negativity behind it, but we got to be taught. We have to be instructed. We have to see. And sometimes for us, it's a matter of tasting it, and you have to change the dynamics of the culture of the family. It can't be just the children. The parents have to be involved. Extended
grandparents
have to be involved. Yeah, they all have to be. And that's the toughest part, is getting people to change their mentality. And you hate to see it, because in my field, I'm seeing people dying all the time from stuff that you could prevent if you could just get people to change certain aspects of their lifestyle. But that is not easy. I mean, that is probably the toughest bane of my existence, is figuring out how to address that particular issue. But it's got to take education, and it takes people getting together. We work in vacuums, in our society, unfortunately. So instead of collective collaboration, we do things individually. So you do touch a few, but I think we could do better if we really kind of banded our collective knowledge together and really say, how do we address this particular problem to make it good? And a lot of people think this stuff is really minor. A lot of people, especially people who are not food insecure, don't really get the significance of this problem. But as it relates to stress, violence, lack of understanding and knowledge, and lack of job participation and opportunities, it could really make a substantial and negative impact. And if we really looked at how do we make it better, if we could do that, I tell you, I think we would be a totally different country.
So if someone is food insecure, so they're grabbing something to eat, so to get rid of the hunger pains, and so forth. And if they have, say, high blood pressure, hypertension, what happens if they don't eat correctly? How does that impact that high blood pressure?
So what you're looking at is, you think about the contents of most of the food that we eat that's not good for us. It's typically going to be high in salt and sodium, and high in fat. So if you look at how does hypertension start, a lot of times people look at it as genetics, and there is some genetics behind it. But I firmly have come to this conclusion that the lifestyle is the predominant factor. Well, I should say, I think it is predominant. I can't say 100% that it is, but I think it is, and this is the issue why. If you look at people don't start off with hypertension when they're born. They develop this over time. So what are the things that we know that develop that create a milieu for hypertension? One is obesity, being overweight or obese. One is the types of foods we eat, lack of exercise. So again, it goes back to that built environment, what's around us. So if you start to gain weight, your pressures will start to go up. Just parcel of what happens. Your body's working harder to mobilize you because of the extra weight, which leads to elevated blood pressures. So when you're eating poorly and this high sodium meals, what that does is just accentuates the immediate problem. So the pressures start to rise even higher. And the reason we know this through data. The literature is full of information saying if you as an individual person are trying to combat hypertension, what's the first thing they say you need to do is trim your sodium back. So, and when we say that, what we mean is you have to look at collectively your diet all day long. How much sodium should you have in your diet? With the recommended daily amount of salt intake in somebody with hypertension should be less than 1,500 milligrams a day, which is much of nothing. A teaspoon of salt is 2,300 milligrams. A teaspoon of salt. So you talk about all the foods you eat all day long, including your breakfast, your lunch, your dinner. It has to be, if you look at your canned labels of your foods, and you start really adding that up, that stuff can supersede 7, 8, 9 grams, sometimes even higher a day. So you're talking about you're supposed to do a fraction of that. So it's the first thing is they say cut back on the sodium. Second thing is exercise. American Heart says we're supposed to be doing some type of moderate activity 30 minutes, 5 days a week. And typically that could be even walking. Walking impacts. When you talk to most people who are trying to reduce their blood pressure and they are saying, okay, the lifestyle things they need to do, sodium restriction, exercise, the weight loss. A kilogram of weight is 2.2 pounds. So if they say for every kilogram of weight you lose, you could drop your blood pressure 1 to 2 points. So you're talking about when you add up sodium intake, weight loss, activity, meaning increase your activity, you could drop your pressure just on that right alone. If you add it all up, the collective impact, you could look at somewhere between 8 and 15 point drop in your blood pressure.
But hang on just a second. If you're just joining us, we're talking about food insecurity and your health with cardiologist and medical director for health equity with Centera Healthcare, Dr. Keith Newby. 757-440-2665 or 1-800-940-2240. Give us a call if you've ever experienced food insecurity. How did you manage? How did you decide what foods to buy? And help us to help others who may be in that situation now come up with some very real and very positive ways to keep from becoming hungry. 757-440-2665 or 1-800-940-2240. So, Keith, if you are in a situation where you don't even have enough money to go out and purchase groceries, and you've got high blood pressure, now you telling me I got to look at labels and I got to walk and I got to do all of this stuff. I mean, at some point, something's got to give. So should the nutrition become your focus, start with?
Yeah, it really should be everything, but if I had to take a pick, I would always start with the nutrition, because that's the thing that can have the greatest impact. All of it has a collective impact that's important. The issue becomes it's a multifaceted problem. It's not just, it's not just what you eat. Even when you think about the built environment, if you look at, do you feel safe in your neighborhood to go walking? Because if you don't, then you're not going to walk.
And you're not going to walk.
And if there are no facilities, there's no gyms or recreational centers or places you can go. What's your transportation like? Do you have the ability to go other places? There are people in Norfolk that's never been outside of Norfolk their whole life. Yeah. Because of lack of money and lack of transportation. So they have been here, they've never even seen Chesapeake, or Suffolk.
Exactly.
Hey, we kind of joke around saying that a little bit, but there's a lot of truth to that. So, if they've never done that, then it means that they have been circulated in their neighborhoods, which means, unfortunately, lack of facilities, lack of adequate health care. If there's no health care there, they may have hypertension and not even know it. They may be diabetic, don't have a clue, because they've never really been to the doctor. We, unfortunately, so in our African American population, we have a notorious problem with going to the doctor. Because again, what they're going to say, there's going to be some painful issues involved. They got to stick me with a needle. They got to do this or do that.
I can't afford it.
All that stuff impacts. But if they don't even have the facility to even get there or a mechanism of adequate transportation, do they have adequate bus service if they don't have a car, to get to a location they need to get to have a healthy checkup?
So, I'm thinking about, and this is no slight on food banks or anything, we have these food drives and all of that. But when we look at canned goods, for example, canned vegetables and so forth, they're always high in sodium. So you're kind of stuck between a rock and a hard place.
Well, to some degree, yes.
But,
to some degree, yes. But this is the problem. We haven't. When you really think about it, we haven't really sat down and devised a plan of how do we address this, truly. Because there's prepared meals, you got Meals on Wheels, where they actually bring food to your house. And,
right.
Yeah. I think we haven't, that's why I was saying, we have a lot of brain power individually, but we haven't put it to a collective purpose to say, okay, we have this issue we have to address. What are the gaps? Where are the gaps?
Mm-hmm.
You know, because if, again, as example, like you get my kids, say that the kid did participate in breakfast and lunch at school. Okay, what about dinner? What about the weekends? What about the holidays? What about the summer?
Mm-hmm.
You know, because then you get some missed opportunities, but that can be addressed if you really say, okay, how do we address food insecurity in our kids or young people collectively in a good way? That's when the churches can get involved, recreation centers, they could be food delivered there, Meals on Wheels for those who can't get out anywhere. I mean, there are ways of addressing it, but we have to collectively come up, but there's resources, so
It's
stuff costs
interesting.
money.
It's interesting because I was out of town recently, and I saw a child bring home a weekend food pack.
Mm-hmm.
And I was just looking through it. I thought it was so interesting. So the cereal had sugar, a lot of sugar.
Yeah.
They did have milk. They had some fruit, but then there was candy. I mean, there was different things that, you just go, is this the best thing for a child to be eating? Now, and I know that there's a catch-22 because you're trying to keep people from being hungry, but at the same time, you also need to be giving them something that is nutritious so that they won't develop things like high blood pressure. Diabetes, type 2 diabetes is another huge issue, particularly in the African American community, and that's impacted by the food you eat also, correct?
I think yes, definitely. And that's where that collective ideology comes in. If we had, say, like the example, you had people who are expert at nutrition that we kind of got their collective intelligence together and we say, okay, what are the gaps? And like those kind of food packs you're talking about, and we say, okay, we're not gonna, and I know there are some people who I don't want to eat that.
Right.
Well, when you're hungry, you're gonna get whatever you can get. In the end, I mean, and I'm like, I was debating with a patient yesterday. She's telling me her mom is 80-some years old, and she gets her all this stuff that she's not supposed to eat because she's worried because she said mom won't eat unless she eats that. I said, listen, mom get hungry enough, mom gonna eat whatever you put in front of her. I said, and you doing what you're doing is not helping her at all, especially not at her age with the medical problems she has. So I say all that to say that if you did a collective kind of look at how we need to change what we do. The reason, like a lot of canned foods, the reason why they give them that is because they have a longer shelf life versus a fresh thing. And I get that part, but there's a way to work around that as well. My church, First Baptist Butte, we have a food pantry every weekend that we get. I mean, and the pastor, our interim pastor, Jerry Holmes, I hope would be our new pastor when we have our vote on Sunday. Because I'm definitely voting for him. I mean, he's just a great guy.
Yeah,
but,
he is.
He has gotten more. I give him so much credit when I look at the connections he's made with the farmers. When we had our farmers market with the Newby Foundation.
Yeah, and I was going to talk to you about that as another way of getting fresh fruits and vegetables to people.
So, a lot of that is what we try to do is that collective intelligence. He and I get together a lot, and and he's part of my board anyway with the foundation. But we sit down and say, what are the problems and how do we attack them? He's got so many connections he's made that he gets a lot of these places that that when they have excess food, they give it to him, and he has a food pantry every Saturday. I think it's from like 11 to I asked him to give me what exactly that was. He does it from 10 to 12.
10 to 12.
And 10 to 12
First Baptist, historic
Butte Street.
Right.
Yes.
First Baptist Butte Street in Norfolk.
And he has fruits, vegetables, sweet potatoes, white potatoes, carrots, chicken, pork. You got milk. I mean, they get all that stuff from these places, and they just provide it to the community in need. So so that goes back to when you mentioned earlier about you may not be poor enough to qualify for certain federal programs, but that's where people like he and the First Baptist and Newby Foundation, other organizations get together to try to supplement that, because unfortunately, so everybody won't qualify. That doesn't mean they're not food insecure.
Exactly.
That was just an arbitrarily number they came up with to say this is how we're going to say that you're poor enough to qualify for federal benefits, but people are still having trouble getting something to eat. So those are the kind of things that we can do that will negate that canned stuff you were talking about earlier. But it has to be a collective body of people together, because you can't feed the world in just one organization. But we're hoping that we create these models that could be looked at and recreated in other neighborhoods and communities. Then collectively you can start feeding families that are really truly food insecure. I mean, the one thing you don't want is people that really could afford it. You'll be coming out there, just because they want something free. I mean, unfortunately,
Exactly.
so that does happen, unfortunately. But I mean, but the design is to bless people who need that blessing, who otherwise wouldn't get it. Because they don't qualify, or if they do, but they don't have transportation to get certain places. That was really the point of a lot of this.
And they're also, you're talking about that collective knowledge. Having nutritionists and others who deal in this space talk about ways to mitigate what could be a negative. So, for example, if you have a can of string beans, rinse them before you cook them.
Try to, now, unfortunately, so a lot of that salt's kind of ingrained in us.
It's already there.
Can for a while, but, you think about what's actually in the water of that can. That some people just take the can, just pour it in the pot.
Right.
So, I do agree, but I think what they should do is probably rinse them a little longer, not just do it for a couple of minutes, but let them sit, for at least a few hours, before you cook them, and I think that would help to try to negate more of that sodium out, that you still could use them. It won't be ideal, but it's better than nothing.
Exactly. So I guess my question to you also is, are there other ways or things that people can think about? So if you have a limited budget, one, time, convenience, everything else might take you to a fast food place or something so that your kids can just grab what they want and eat. Or instead of doing that, what should you be thinking about in terms of something that would be healthier for you and your family and can still stay within that range of whatever your budget is?
I think a lot of it is going to be based on your choices. If you look at, like, say, for example, you did go to McDonald's, they have other choices there other than just hamburgers and French fries and chicken. And they have some broad options. They have some salad options there, that could be, but you could jack up a salad too if you put too much dressing on it, the wrong type of stuff. I mean, I told you could do all kinds of stuff to try to make something good, bad, really, really, really quick. But when you look at it collectively, say, okay, it's all about the choices you make. The issue is with kids, your kids, listen, my wife used to get my daughter, my youngest one, when she was always saying, I don't want to eat that, what y'all made. I want to eat X. My wife's like, well, then I guess you just won't be eating today. And she's old school when it comes down to that, and rightly it should be that way. And then, if you like to say, kid get hungry enough, they're going to eat whatever they put it.
Exactly. 757-440-2665 or 1-800-940-2240. Are you in the nutrition space? Do you have a garden? Do you do food giveaways? Are you involved in helping people who are food insecure? Give us a call. Let us talk about your organization. 757-440-2665 or 1-800-940-2240. So I came to one of your farmers markets, Dr. Newby, back in the summertime, and I had the best time watching the corn shucking contest. I mean, honestly, because you were throwing out facts, you were giving tips and information, and people were having fun.
And
that's
I
think,
really what it's for.
And I think that's another way. You already feel bad enough, I think, if you can't afford to just go into a grocery store and buy what you want, or life is just kind of giving you a raw deal on the financial side. So you're already feeling bad enough as it is, and then if you have to go and stand and watch people stare at you while you're getting your food, or you're standing in a food line, or whatever. There's a piece of dignity, I think, that is important that we also recognize. And that's the thing I loved about the farmers market that you all had, because everybody was just having a good time, and everybody was walking around and talking with each other, and interacting. And so you didn't know, one from the other, what was, what their situation was. And I think people may have felt more comfortable.
Well, I think that's true, and I'll be honest with you. The one you came to was our first one we had ever done, and I was on the seat of my pants trying to figure out what to do, what to say. I mean, a lot of people say, "Oh, you really had that handled." I was like, "Not really." I was like, but
we're always harder on ourselves.
Yeah, and that's right. But the whole point of that, and the vibe I wanted to create there, was one of community, family, fellowship. So, and if you looked at the vendors we had there, I had people that were there selling spices. And a lot of people won't come to farmers markets because they think that the price of the food is higher than the stores. It really is lower. It was significantly lower than you would get at the stores. And this stuff was right out of the ground. It wasn't sitting, in some warehouse forever, And the thing is, the whole point of it was designed to teach, to educate, to commune, to fellowship, to really have some fun. And I was joking on everybody. I was having myself a good old time up there. And I was just ad-libbing stuff left and right because the whole point was to create that community. And that was one of the things that I really enjoyed. And we actually had such a good response that by the next one we were getting to where the vendor list was starting to grow. I was like, wait a minute, we can't take with so many vendors here, but the whole point of it was people saw what we were trying to do, and the message we were trying to send was, again, we went back to talking about how you can make something good really bad really quick. We had people doing cooking demonstrations there to really show, okay, this is how you can do this. We had some tasting samples there, so that everything was in that fresh route. There wasn't a bunch of salt you poured on it, or the neck bones and whatever else. We really wanted to show that you can do this and not in an emergency room that night with a blood pressure of 200. Without. And it still will be good food. And it's just really getting people out. And we're hoping that if we can educate our community and really show that, and then teach people how you can budget your money in a way that you can have these good food options, keep your family, safe, and keep them healthy. And it can be done. But I tell you, Barbara, the one thing I learned, I'm trying to stay away from that term health or healthy, because that seemed to turn people off. It's like, I don't want to hear about this. And so I'm trying to use other terms that otherwise would get the same message done, because it becomes a stigma. People just think that this is going to be something boring or nothing they want to be involved with. But I really do believe that we can make that collective impact in a positive way. Because, again, when I work at that Norfolk General Hospital and I'm seeing in the emergency room stroke alerts, heart attacks, heart failure, which we see a lot of, and I guarantee a lot of that comes from the blood pressures that are high. Because, again, remember, all these disease processes we talked about, hypertension, diabetes, high cholesterol levels, typically they are asymptomatic. People won't feel anything but their pressure's through the roof until the stroke hits, until they end up on a dialysis machine, until they have heart failure, or whatever the complication will be. And that's the part we're trying to negate. So if we can change the dynamic and the narrative of how people view nutrition, and truly help those people who are food insecure, how do we collectively figure out how do we make them, put them in a better space? I really do believe we can make a significant impact on people's health.
So we got a call from Jim. He said that a lot of canned foods now come in low sodium or sodium free. So thank you, Jim, for that for that tidbit.
So, but the one thing with that, I tell people, caution them. What does low sodium mean? That's why you have to know the labels, because if, say, a can of soup had 8 grams of sodium in it, if I do it and I create a can of soup that has 7 grams, that's lower sodium. It's lower than the 8.
Good
but
point.
does that really make it?
But does that matter? Yeah.
Yeah, does that matter? So you have to make sure you look at those labels on the back.
Okay.
How much sodium is in it, and then the number of servings in that container. Because if I put 50 milligrams of sodium on the can, but it has 20 servings, that's 20 times 50, which is if you eat that whole can. So you have to look at the marketing strategies that sometimes they use. And I agree with Jim that you have that's better to have that, but just make sure you know, if they say like no sodium, make sure you look at that back of that can. It better say 0.
In order to make sure it's no sodium. Yeah.
I mean, because they'll say like no sugar, but then it says 2 grams of sugar on the back. I'm like, then it's not no sugar. I mean, and I'm trying to figure out, there's something, I guess, in how they do it.
Well, you also have to learn the terminology for sugar and so forth. Do you think the labels are too complicated for people?
Some of it is. Some of it is. But then that's why people like myself, we need to make sure we're educating the community on how to read those labels. And because it really is not, once you know how to do it, it's really not difficult. But when you see all these numbers on the back of a can, you just got to know where you want to put your focus.
Yeah.
And once you learn that focus, because really it's all about the total amount, which is what they'll put, and then you look at the total number of servings in that can, or whatever that is. And I think if you just focus on those 2 things, and then you'll know, okay, how much of this can I have?
So
and stay within the diet.
As a cardiologist, how much of your time with patients has to do with nutrition as opposed to whatever their heart issue is?
It depends on who they are and what their problem is. If it's heart failure, I got to spend the time. If it's hypertension, I got to spend the time. I don't, of course, as a cardiologist, I don't treat diabetes, but I have to deal with the aftermath of diabetes. So if something they're doing is impacting, I mean, if I would say if I had 100%. How much am I going to spend on nutrition? If it's a hypertension patient, it depends on if I know they're trifling and they're not doing what they're supposed to do, and they try to lie to me like I'm an idiot or something, and I can look at their eyes and tell, I will spend 50% of the time hitting them up on that. But if I have a patient who I know is, trying to do their best with that, and I know they really understand the dynamic of nutrition, then of course it's going to be less. So it's really dependent on the needs of the patient, but unfortunately, a lot of people need more help than not help.
Yeah. Let's talk to Greg in Hampton. Hi, Greg. You're on the air.
How you guys doing?
Hello, Greg. Are you there?
Yes, I'm here.
Yes. Hi. Yes, we can hear you now. How are you?
Okay. I'm doing great.
Good. What's your question or comment?
My church has a food it's a Meals on Wheels, and we deal with the food security. I'm in the background. Okay. And I think what it is the flow of food coming in, and when they're not sure when it's getting the next meal, when they get that food, I don't know they eat it all up the first day, but they don't know when the next meal is coming.
He brings up a very good point.
Thanks for the call, Greg. Go ahead.
He brings up an extremely good point because that's about resources. Because if, you talk about, you have to have enough food to be able to supplant people, so that they will have the Meals on Wheels to be able to grant to people. So you have to have a good enough flow of resources and food coming in. And that's where the collective body comes in. And if you pick, like, say, this neighborhood, we're going to make sure this neighborhood has adequate amounts of food for their, nutritional health. And you found a way that's where the partnership comes in with churches, with rec centers, with Meals on Wheels, so you can supplement that. And there is enough. Do you know how much they throw away? When you really think about how much food is actually thrown away versus eaten. So the food is there. It's a matter of channeling to the resources necessary. So his point is very good, but that's where it takes that collective body to figure out how do we address this and not be wasteful at the same time, so that people get what they need.
I was thinking, we were talking in our production meeting about this topic, and I was telling the crew, I remember as a child, on occasion, when my mother would make a lot of fun, and she'd say, "We're having breakfast for dinner."
Yeah.
And not until I was an adult did I realize, oh, that was stretching because it was close to the end of the month.
Yeah.
So you have to get creative with it also. It just doesn't mean that every time you have dinner it has to be a meat and veggies. It could be, you may need to switch it up a little bit or do some boiled eggs or whatever.
Well, and you kind of say, though, this is like one of the richest nations in the world.
Yes.
One of the richest nations in the world. And we can't find a way, to handle this problem. The problem is, again, you could talk about the top 1% of people with all the money, unfortunately. So, but when you think about, and a lot of people don't really understand, that's when it comes down to the term health equity. A lot of people think, I've had more debates than people when they'll say certain groups of individuals, well, all they just did X. They'd be fine. They'd pull themselves up with the bootstraps, and do. And I say, well, you got to have some bootstraps to pull up on.
Exactly.
I said, and do you think about a systemic racism issue that you, from the time you were born, you're destined to fail in certain situations?
Mm-hmm.
That has to be addressed.
And we all have to care about it. Every one of us. It's not their problem. It's all of our problem.
Barbara, if I could say this, because I know we're about done here. The thing that breaks my heart the most, though, is the unfortunate reality is this nation has become so selfish and self-centered in terms of what you kind of see on a day-to-day basis. People impatient with other folks, and it's like, okay, well, it's not impacting me personally, therefore it's not my issue. And that's not really. And I had hoped that we could band together and maybe try to take that philosophy and throw it off to the side, and let's look at how do we help other people, because that's what brings me joy.
Exactly.
When I help other people. So anyway, that's a little my 2 cents worth of the day.
So in the last minute and a half that we have, how's school? And how are you doing with the grades?
It's a high pass in Chapel Hills.
That's right.
High
pass. That's
pass,
right.
And of course marginal, and you need to go somewhere.
Well, we know you don't have any of those.
No, I'm high passing. Listen, my wife picks with me all the time. She said, "You a high achiever all the time," because that's what I do. So I'm high pass across the board. I love what I do, and I love learning, and I love trying to see how I use this information to help somebody else.
That's
fantastic. My Christian deacon background,
there you go.
And I love doing it. So hey, thank you for asking, but I'm doing great.
Oh, that's great.
In fact, I'm about to sign up for another program now.
When is graduation? When are we going to get ready to celebrate your next degree?
Next year. Next year.
Okay.
Yep.
Okay.
I'll be done because I can't take but so many classes a semester. But my crazy tale, I'm signing up for another program. I'm going to start in December.
Okay.
As a chief medical officer program, I'm doing at Emory.
Oh wow!
Which is one of my places where I did
my
internship. All right.
Just make sure you save room for another view.
Yes, ma'am.
Thanks so much. That's Cardiologist Dr. Keith Newby. And thank you, audience, for spending an hour of your life with us here on Another View. We shared some important information for your health on today's show. So share it with someone you love. Go to anotherviewradio.org and download the podcast. And please sign up for our eView newsletter. It's a once-a-week reminder of upcoming shows. The Another View crew sends our sincere condolences to the family of our beloved colleague, Dory Morrison. Her celebration of life service starts in just a few minutes in Virginia Beach, and we send love and light to her husband Shane, daughter Claire, and all who love her. Thank you to Lisa Godley and Dr. Barry Graham for representing Another View while we're out there. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Jordan Christie is our audio engineer, and Danielle Saunders answered our phones. I'm Barbara Ham-Lee. Make it a wonderful weekend, everyone, and let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever, whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.